Your dog may be your best friend, but after shoulder surgery, it can also be your worst nightmare. Imagine this. You survive the surgery, you're carefully protecting your shoulder, and then your Labrador sees a squirrel who wins and tug of war. Spoiler alert, it's not your rotator cuff that wins. Most patients think they're failing during recovery, but the truth is the system is failing them. I created this channel to be the voice that shows up when no one else will. So you have this clear advice, clear answers on what's happening, what matters, and the reassurances that you're not alone. So, my dog's right over there. Okay, hey there, I'm Dr. Daniel Orcutt. I spent years helping over 1,000 patients recover from shoulder surgery and shoulder injury. And just as much time getting frustrated at how little real guidance most of the people actually get. So if you're dealing with pain, prepping for surgery, or just wondering what you're going through is normal, you're in the right place. I'll cut through the noise, give you the truth, and help you heal smarter. So let's dive in. So the risks, right? Let's start with the risks, because this is where most people, they underestimate things. Big dogs pulling on a leash, that's not just annoying, that's a one-way ticket to stressing your repair. Unfortunately, I've seen these setbacks before, from the helpful Labrador or the other big dogs. Labradors, then for patients forgetting to ice. Then there are the jumpers, the dogs and cats. They don't care that you had surgery. In fact, they sometimes sense it. They just care they want to be close to you for a few hours. They know you've been gone. So when you walk in, they greet you with a full body launch, which is exactly the kind of surprise force your healing shoulder does not need. And then there's one story. I'll never forget this story. A patient once told me that her cat was actually helping her heal. Why? Because the cat kept licking her incision. She said, completely seriously, doctor, animals' mouths are cleaner than humans. It's a natural antibiotic. And I had to explain, no, cat saliva is not sterile. It's not wound care. It's actually a recipe for an infection. Now, I love cats, but if licking wounds was good medicine, Neosporin would come in tuna flavors. That's gross. Keep pets away from your incision, period. By the way, if you haven't grabbed my pre-op shoulder surgery checklist, the link is down below. It's a simple step-by-step guide to help you feel more prepared going through surgery. There's some few tips about planning. So the bottom line in the pets, the danger isn't your pet, it's the timing. Those first 6 to 8 weeks are when your shoulder is the most vulnerable. And even a little accident can set you back months, or even maybe you have to restart again. All right, so planning ahead. The good news is most of these problems are preventable if you plan ahead. One option is actually boarding your pet. My wife would never do that for 1 or 2 weeks. Not everyone likes to do it, but it gives you breathing room in the most fragile phase. Another option, phone a friend or 3. Some of my patients have built a little dog walking co-op in the neighbors, right? They take turns helping out in exchange. Someone bakes cookies. Honestly, it's cheaper than another surgery. Professional help is also on the table. You know, a dog walker, even for just the mornings and evenings, that can save you from risking a leash mishap. And for the record, most dogs love variety. And inside the house, think about rearranging it. Maybe your cat doesn't get the bedroom access where it used to. Maybe you block off the stairs so your dog isn't sprinting at you like a linebacker. Think of it as pet-proofing your recovery, kind of like child-proofing, except instead of sticky fingers, you got a tail and some big tongues. All right, the healing side. Now here is the flip side, because pets aren't just hazards. They can actually be good healers. There's real research here. Animals-assisted therapy have been shown to reduce stress, improve mood, and even lower blood pressure. And anyone who's ever had a cat purring on their lap knows you don't need a medical journal to feel the difference. The truth is, recovery isn't just physical, it's emotional. You're frustrated, you're sleeping in a recliner, you're tired, you feel helpless. Having your pet nearby offers routine, companionship, and a little joy. And that can make those hard weeks survivable. So sometimes the thing that gets you through the 3 weeks isn't the ice pack. It's the way your dog still looks at you like you're the best ever. That emotional boost is real medicine. Just remember the key. The key is when. Early on, you need boundaries, you need backup. Later, once the shoulder is a little sturdier, pets become part of the recovery team. They get you outside, they remind you of your normal life, and they give you a reason to keep moving forward. So pets after surgery, help or hazard, the truth is they're both. In the first few weeks, they can derail your progress if you don't plan ahead. But with smart preparation, perhaps boarding, dog walkers, rearranging the house, they don't have to be a hazard. And once past the fragile stages, pets can be one of the greatest sources of healing, motivation, and comfort. So, how are you managing your pets after surgery? Comment below. Dog walkers or boarding? I'd love to hear your hacks. I promise someone else watching will benefit from this experience. And don't forget, download your pre-op checklist if you haven't already. It's in the link below. If this kind of straight talk is helpful, hit the like and subscribe. It helps more people find their way through recovery without all the confusion. And if you want to keep learning, watch this next video. You'll see it on the screen after me. And here is the typical disclaimer. This information is for educational purposes only, and it's not medical advice. I am a physician, but I am not your physician. This content does not create a doctor-patient relationship, and nothing here should be taken as a diagnosis or personalized treatment plan. As always, talk to your own health provider before making decisions about your health. Thanks, and we'll see you next time.